Geropsychology is a new section of the American Psychological Association and a discipline in which the focus is the application of clinical and counseling psychology with older folks. It's had a rather long history, but maybe short past, and it's grown measurably in the last decade. There are now 7 to 10 graduate schools that are focusing only on geropsychology, the study of older adults, from the clinical stuff that we're doing to the more geropsychology or gerontology part of things, which is adjustment across the lifespan and adjusting in life in ages 70, 80, 90 in cities, in rural areas, different cultures and questions that evolve from those different habitats. So this is a long-winded answer that basically says that it's the application of psychology to people at later life in all of the facets that you would expect them to have issues and concerns in middle life. And there are demographers out there now who are saying that modally people who are born in this century are going to live 100 years. And get ready for the explosion, huh? As people get older, they start to have trouble with their brains, trouble with memory, trouble with executive functioning, trouble with speed of processing, dual attention, and the like. And so what's happened in the last decade is people have really tried to differentiate that normal aging from mild cognitive or age-associated memory impairment stuff to the dementia stuff. And we've gotten pretty good at that. We're not perfect. But the clinical psychologist, the neuropsychologist, the geropsychologist are now getting better norms, better tests that are more sensitive and specific, to being better able to differentiate those groups so that we can better tell who is in what category and make a reasonable projection as to their trajectory. That's been an issue. I mean, if you've seen one person that has a mild cognitive impairment or one person who's early dementing, you've seen one person, because their trajectories can be all over the place. And so you start making inferences where they're going to go, how difficult it's going to be, based on the causative agents that are causing trouble, like Alzheimer's disease or Parkinson's disease. They have different trajectories, they have different problem focus, different phenomenology, as well as what the person comes to the table with, their brain reserve, their person reserve, how skilled they are, how much education they've had. You can imagine the Princeton physicist having a mini mental state of 20 and somebody from rural Georgia having a mental state of 20, and they both have the same score, but they're very different people.
What specialty would a neuropsychologist have over a clinical psychologist?
Well, I think the one area that neuropsychology has become very interested in the last decade with their professional organizations has been a refined assessment of dementia. And what that has meant is the following. It's not lengthy evaluations, maybe nothing longer than 3 hours. It used to be all-day kind of events where somebody would be evaluated all day. That doesn't seem to apply and make sense. The incremental validity of a measure that you would give, or a series of measures for 3 hours versus 8 hours, does not seem to be worth the extra time. And trying to make reasonable inferences about the type of dementia, about the level of dementia, and about the reasonable rehab or retraining that can go on with that person over time. You'd certainly want to have the person aware that there's something going on. You'd want to have the environment structured so that they can maximize their abilities with executive functioning and memory, which tend to be the bad guys. Attention and visual spatial stuff are also problems, but those first two are special concerns. And you'd want to have the person hopeful, the environment hopeful, so that they can do things that they can do and feel optimistic about what they are into. That said, you know, there's not a whole lot new you would do with someone who's in, say, the more severe stages of mild cognitive impairment and early dementia.